Hello, I'm Dr. Patrick Hwu, and we're here in Houston, Texas at the 2024 SITC annual meeting, and I'm honored to have Dr. Christine Chung, head of our Head and Neck Department at Moffitt Cancer Center, here with us today. Thank you for joining us.
Thank you for having me. So, as you know, that significant number of head and neck cancer is caused by human papillomavirus infection, or HPV, and there's a lot of studies going on right now try to target the root cause of head and neck cancer, which is HPV. So there has been extensive studies using various HPV targeted agents such as HPV vaccine and some of the novel agents such as Q101. So I have the privilege to participate in Q101 study, and it will be presented this afternoon. And Q101 is a novel class of biologics that selectively engage and expand and activate HPV-16 specific T cells. So it is comprised of Fc fusion biologic that presents HPV-16E7 specific peptide that's linked to MHC. And it also carried IL-2 molecules that trigger T cell activation. So we have done clinical trials, dose escalation and dose expansion study, and we also studied a combination of Q101 with pembrolizumab, and we have found that overall response rate was 46% when historical control is only 19% given pembro alone compared to the combination, and median overall survival was 21.8 months given the combination when historical control is only about 12.3 months. So we're very excited about developing new agents that can help our HPV positive cause head and neck cancer patients.
Well, that's a very exciting study that you're talking about. Did you look at any of the blood or tumor to see if you're getting more T cells that are HPV specific after you give the combination?
Yes, that study is currently ongoing, and at least the preliminary study shows using the tetramer formation that there is expansion of a T cell, HPV-specific T cell expansion.
Yeah, and more that you would see than just giving pembrolizumab by itself.
That's correct.
Yeah. Oh, well, that's really exciting because you're stimulating both the specific antigen and the TCR, as well as giving the growth factor interleukin-2. Yeah. So it sounds like a great combination.
Yeah, and the more exciting thing about it is HPV targeting vaccines. So far, it looks to be most efficacious in patients with the PD-L1 CPS greater than 20 tumors. But with Q101, it seems to be equally effective in low PD-L1 and high PD-L1 expressors.
Yeah, so you can probably, if there's not as many T cells in the head and neck, you can probably, in the tumor, you can probably induce their proliferation and increase that with the agent, right?
Yep.
Yeah, that's very exciting. So after this study is a phase 2 study? Mm-hmm. Yeah. Well, what's the plans for this agent?
So the company is trying to conduct a bigger study, and with a control arm, because this was phase 1 without a control arm. So next it's conducting a bigger control, placebo-controlled arm to further validate this early study findings.
Great, wonderful. It's really exciting, and congratulations on this work, and can't wait to see future studies as well.